Today I am going to present an interesting case of orbital COVID-related mucormycosis with orbital apex syndrome. Mucormycosis is a debilitating invasive fungal disease which is commonly called as black mucus. This disease is a predilection for severely immunocompromised patients. Rhinoorbital mucormycosis, whereas it's an entity wherein nasopharynx is affected first, which then rapidly spread to orbit and then to brine if not treated aggressively. This case is being presented to enlighten the need for prompt intervention as to prevent the life-threatening complications. My case is a 49 years old male who is a known case of uncontrolled diabetes with a positive history of COVID-19, presented with a sudden onset of protrusion of left eye and with a loss of vision. On evaluation, patient had total ophthalmoplegia with no perception of light in the left eye and with complete ptosis with axial proptosis of 25 mm and pupil was 4 mm not reacting to light. Since the patient has nasal symptoms, ENT opinion was obtained and imaging by biopsy were done. This is the MRI image which showed T1, T2 hyperintense mucosal thickening seen in left maxillary sinus, which suggestive of fungal sinusitis with left orbital cellulitis with proptosis and with optic neuritis. An histopathological examination also revealed invasive fungal infection with consistent with mucormycosis. And based on the clinical features and the above imagings and histopathological examination, patient was diagnosed as left-sided rhinoorbital mucormycosis. To prevent further complications to spread to the brain, with a collaboration with the ENT department, the combined functional endoscopic sinus surgery with total lid sparing orbital excenteration was done for the patient. This is a picture of post-op patient. Rhinoorbital mucormycosis is a rare fungal infection with high morbidity and mortality despite appropriate and adequate treatment. Almost it always occurs in immunocompromised individuals. Though mucormycosis exhibit variety of clinical symptoms, rhinoorbital involvement is the most common clinical presentation. Being a rapidly progressive disease, even slight delay in the diagnosis or appropriate management can cause devastating implication on the patient's survival. To conclude, ocular manifestation or initial presentations presenting symptoms in case of rhinoorbital cerebral mucormycosis. This devastating and debilitating COVID-related mucormycosis has many atypical unique features which cost the life and vision of the patient with various ocular manifestation if not intervened at the earliest. These are my references. Thank you all.
Thank you, doctor. So, what was it? I mean, what was the time difference between when the patient was COVID positive and when he developed this?
Actually, 2 weeks before.
2 weeks before. So, what was the treatment? What was the treatment that he had received when he had COVID? Was he on high dose steroids?
Yes, sir. High dose steroids given. Specifically, the patient was not on any COVID vaccination. Not in vaccination. Severely uncontrolled diabetes, sir.
Okay. So, how long was the patient followed up after the surgery?
After the surgery, he was advised to actually monthly follow-up was done, sir, and patient was advised for a prosthetic eye, but he was not willing at that present time, sir. So lost to follow.